Hey everybody, it's Dr. Golden, and as so many of you know, one of the things that have driven me crazy about our coverage for obesity care in the state of Wisconsin is that our Wisconsin Medicaid program, also known as Forward Health to many, that they've provided coverage for obesity management medications for many of the recipients that qualify, but it's been under this weird 2-year limit where you just get the benefit for 2 years, and I guess you're supposed to figure it out from there. So that will be different July 1st. Now, of course, with any deal, we often see some changes that maybe we don't like as much, but there are opportunities here. So what does this look like? So starting July 1st, patients in Wisconsin with Medicaid benefits, known as Forward Health, if they have a BMI of 27, with 2 weight-related conditions, and they're going to be picky about which ones those are, but it's pretty reasonable, or a BMI of 30, will have access to 2 preferred medications: Zepbound, both the auto-injector or the quick pen, or Foundayo, which is the oral tablet. They will no longer have access to Wegovy for weight management unless there was a prior PA approved, and there'll be a time limit to when that has to be transitioned to their preferred medications. Okay, so this is for adults with obesity. For our teenagers with obesity, they will have access to the Wegovy subcutaneous injections, not the tablets. So it's going to depend on your age, what type of conditions you have related to your weight, and whether or not you have other indications. So once you're on these medications, how long do you get to stay on them? So the initial prescription will be for 183 days. Don't ask me why, but it's 183 days, that initial approval. And then if you have any improvement in BMI, you're able to continue the medication. And then the annual reevaluation. So once a year, there'll be a reevaluation to make sure the medication is still working for you. And then it's approved at that point. So no more 6 months trial off, no more 2-year time limit. So for those of you who have been on medications that have been very helpful for you before and you lost them, or you've been worried about this occurring in the future, there's some relief. If you're in that 6-month gap, there are a lot of opportunities to get back on your treatment starting July 1st. Okay, for individuals that have an indication outside of obesity, like if you've had history of heart attack, stroke, or if you have just the indications to reduce your risk of cardiovascular disease, or maybe you have what used to be known as fatty liver disease, now we call it MASLD, with changes in your liver, then you may be able to use Wegovy under those indications. So there's additional options. We just have to evaluate it and see what you have that's available for you as an individual. But that time limit is gone, and that is what's so incredibly important to help us start to be able to treat obesity like the chronic disease that it is in our patients that have Medicaid benefits. So what medications are no longer covered at all? So medications like phentermine topiramate, known as Qsymia, phentermine generic, orlistat, and Saxenda will no longer be covered. So this all happens next week, July 1st. So if you or someone that you know or love needs help and will qualify at this point in time, please have them scheduled with their primary care provider. They can definitely come and see us at Weight and Gold in Madison or Watertown, Wisconsin, or at Weight and Gold, we can see patients virtually across the state. So I hope this has been helpful. It's so exciting to share this change, but we still have work to do because we want to make sure our patients have access really to all tools in the toolbox. All of these medicines should be available to patients because our bodies all respond differently and we have no control over that. So we want to keep fighting for full access to all medications that are available. However, we are going to celebrate that patients no longer have to count down the days until they no longer can keep their treatment for a disease that has affected them for so long. So, good news.